Hi, my name is Amy, and this is an episode of Gentle Mental Health today. And our topic is very close to my heart, something that I have a lot of personal experience with, and that is bipolar disorder. I think there's a lot of confusion about what it is and what it isn't, and we're just going to shed a little light on it. And I'm going to be using the Know, Show, and Grow model that I use for all these topics. And I hope there's some little nugget in here. I'm sure there is. So let's get to it. To know bipolar disorder. Oh, and an aside right away. There are two types of bipolar disorder, bipolar 1, which is what I have, and bipolar 2. I'm not going to go into great detail about the differences. That's a little more of a clinical conversation. And today we're just talking generally about bipolar disorder. So, to know bipolar disorder is to understand that it is a chronic mental health condition characterized by extreme shifts in mood, energy, and behavior. People with bipolar alternate between states of mania and states of depression. Now, what does that mean exactly? Mania is described as euphoria, increased activities, either doing things faster or doing a lot of things. It's like a compulsion. Increased talking or increased speed of talking. I know in my case, during my manic episodes, I would talk very fast, and my normal pace of speech is rather moderate, as you can see here, how I'm talking normally. But when the mania comes in, I talk very, very fast. Like there's an urgency to getting everything out. And also, very many tangents get introduced, and I'm trying to keep track of all of those as well. So this is, like I said, a personal topic for me, bipolar disorder. Mania also includes decrease in sleep, either decrease in the amount of sleep or a decrease in the quality of sleep. Racing thoughts, grandiose self-esteem, and impulsive actions. Now, I'm not generally an impulsive person. I'm very much a planner, and my mania looks very impulsive. Like I'll just take up and take a 3-day drive for no reason. It's true. It happened. Extreme mania includes hallucinations. I also have had some very vivid and extremely scary hallucinations. It may include a psychotic break, which I have had, and I live to tell about it, and I hope I'm helping people with that decision. Self-destructive behavior. So self-harming or, just high-risk behaviors along with self-destructive. High risk, like reckless driving is one. Unsafe sexual behaviors could be part of that also. And I would also put in here, based on my experience, that extreme mania, for me, when I was escalating into that like high manic state, that I blacked out. There were things that, were happening that I just wasn't aware of in that moment. just blacked out. It's like you can only, push the mind so far, and everybody has a breaking point. And now I know that because I've had mine and lived to tell about it. And I really hope that I'm helping other people with this type of disclosure. So that's all about mania. And I think the word mania may be, a bit misused. So I just wanted to cover it very well. So, like I said before, going back to the description of bipolar, bipolar people alternate between mania and depression. And so you would have a state of mania for, I don't know, a few hours, or in my case, it lasted a few days. And then they alternate into a state of depression. And bipolar used to be called manic depression. So you have sort of that manic intensity, but inside of a depressive state. If that makes sense. I hope so. So just a quick description of depression. I just did an episode about depression here on the Gentle Mental Health channel. It's not a channel, no, but I'm just saying that. Depression, loss of interest, fatigue, sadness, hopelessness, worthlessness, and thinking of death or planning suicide. And it is not uncommon for bipolar folks to plan their suicide. It's a very, very dark place that can be accessed with manic depression. And we're going to get in a little bit into the actual brain function, which I find fascinating because I'm kind of a science nerd. The gray matter of the brain in people with bipolar is significantly impacted. Wow. Imaging studies, meaning images of brains, something like 1,800 different images were taken of different people, some with bipolar and some without. Imaging studies confirm that the parts of the brain that are affected with bipolar disorder are emotional regulation. So emotions can be all over the place with bipolar. Executive functions and memory. I can confirm that since I started having my worst manic episodes, my memory has been terrible. And it may be that, or it may be, medications I'm on or whatever, but memory is definitely affected me personally. Parts of the brain, like the anatomy of the brain, would be the prefrontal cortex, which is responsible for impulse control. So if there's damage or diminishment of that prefrontal cortex, you would have less impulse control. The amygdala, which is the emotional center of the brain. I also talked about the amygdala during an episode that I did on anger a couple of months ago. So it's a very important part of the brain. And the hippocampus, which is crucial to memory. And in bipolar people, the hippocampus is actually physically smaller than a person without bipolar. That is amazing. So all of these things going on with the brain, you have mood instability, you have cognitive deficits, and you have emotional dysregulation. So you can't regulate your emotions. And that's where, professional help comes in. Therapy and medications done properly. The number of manic episodes can be related to the rate of changes to the brain. Illness progression can lead to more significant structural alterations over time. So that means the more manic episodes you have, the more damaged your brain becomes, which is such a great argument for getting the help, getting the therapy to keep that mania from rearing its head. There's no sense in living your life just to avoid mania. Identify triggers, things like that. Avoid the triggers. Get the medication that you need. Showing bipolar disorder, symptoms can vary widely from extremes to moderate presentations. There's something called anxious distress that people with bipolar often experience. I know I certainly have and did. Melancholy, which is just a deep, deep loss of enjoyment of living. And psychosis, which is a break from reality. And people with bipolar have physical differences in their brains. That is amazing. To grow with bipolar, I can tell you that when I was first diagnosed with bipolar 1, I thought it was something that I would get over. And one of my biggest realizations was, this is not something to get over. This is like something to live with. Does that make sense? It is a lifelong condition that can be effectively managed with a personalized treatment plan. Like I've been saying, professional therapy. There's plenty of therapists who specialize in bipolar disorders and medications and living healthy. And by living healthy, of course, I mean, diet and exercise and sleep, but also reduce your stressors. Definitely, pay attention to what is stressing you, because that leads directly to depression or mania. And be around also people who are healthy, people who won't, make you feel bad for having bipolar disorder. I'm sure you didn't ask for it. I certainly didn't. There are things that happened in my life that I think are major contributing factors to me having bipolar. And that's what my podcast is about. Quick commercial break. I have a podcast called A Bipolar Storm, and it's on all the platforms. Back to this. Usually people are diagnosed in their 20s. I was not diagnosed until I was 50, but my behavior in my 20s was definitely going from manic to depressive. And people just wrote it off like, oh, she's young and, acting crazy or whatever. Sure. And I was bipolar. Suicidal ideation is not uncommon in bipolar people. And I am going to conclude this segment of Gentle Mental Health with the number 988. And that is a suicide and crisis hotline in case you or someone you love needs it. Thank you for being here.